Very good evening, friends. Meeting again in the session of Materia Medica. And today we're going to start a very important constitutional remedy. A remedy which has a big depth, a very depicting remedy, big anti-historic
Divine
remedy. Anti-historic remedy, the graphites, a pure carbon. If you understand the carbon, if you understand the graphites, then you will understand the carbo-veg, you will understand carbo-animalis, then you will understand the calcarea carb, the kali carb, the strontium carb, the carbon element out of all those remedies. That's why it is necessary to understand the carbon. That's why it is necessary to understand the graphites properly. This remedy has nearly about 40 to 50 days action. It is very deep penetrating remedy, but has very important features and with which we can understand it. So I will share two cases today. This remedy, it is not possible to cover the remedy within a day. It might require another lecture. So today we'll first learn about two cases in my practice. A case of 45 years female, she came to me. That is around 10 years back, this case was there. She had a very severe profuse gushing leukorrhea. And she had treated for it every time she used to consume some allopathic medicines, even she had consumed the vaginal tablets, diagnosed as vaginal candidiasis, but it never worked properly. Temporary, whenever she used to consume all those medicines, she used to feel better, and it was recurrent. It was associated with a oligomenorrhea, and she had very irregular periods. She used to get periods every 2 months, 2.5 months. Many times it might be 40 days, not fixed, and a scanty menses. Second important thing, she was quite obese, but obesity was characteristic. The obesity is unequal. It is not proportional obesity. The proportional obesity you can get more commonly with the calcarea. They are, even though they are obese, they never looks like obese. But in case of graphites, this obesity is unequal distribution of fat, which you can find it out over there. So that was her lower extremities, the legs, they were quite big. They were looking odd considering to her body weight. That was important thing. I took the whole history. Two important things which she has mentioned. She had a chronic constipation in childhood, and every time she has to pass the stools, she has to strain a lot, and stools, they are quite hard, large. Mm, every time she used to pass it, it is very painful for her. And her activities, when I was observing, when she entered in my clinic, whenever she entered in my consulting room, there was a little bit slowness in activities. Most important thing, when I discussed about the features regarding the mental state, she said, I'm quite emotional, excitable. Slightest thing is sufficient to disturb me, and then I get excited. It might be a happy event, it might be a sad event, whatever it may be. I never forget that. And then I become so excitable, and unless and until I share the whole thing with others, it is not possible to get relief. Generally, I used to weep a lot. And whenever I weep, then I feel better. That was very important feature which was there. And when she was sitting in front of me, her lower extremity was continuously just moving. It is fidgetive of lower extremity, which was restlessness of lower extremity, which was observable. So I asked, just is it there with your lower limbs? You are just moving it. It is always there. And then she said, yes, always my husband comments on it, but I cannot stop that. It continuously moves like that. So it was a wonderful case at the age of 45, the climacteric age generally starting with obesity, unequal distribution of fat. Whenever I used to observe, I used to consider this is graphites, this is carbon. Leukorrhea, which was very profuse, gushing, very important. That is again a characteristic of graphites. Constipation, chronic constipation, where large heart stools, difficulty in passing, straining a lot, again a very important feature. And most important modality, the excitability better by whipping is very important in this. Fidgety of legs, yes, Dr. Chandrakant Bhavkar, he is there. I'm happy you are in the session. Very good student of mine doing very nice practice in homeopathy in Mumbai. So happy to see you. So this was very clear-cut graphitis. I have considered graphitis and I have started graphitis, giving graphitis in 30 potency repeated doses for 3 to 4 days. And I asked her to meet me after a week or 7, 8 days. And she returned after a week. Most important thing that she told, doctor, since long time I was not having such a better feeling regarding my abdominal complaints, regarding my stools. I used to pass daily stools without any trouble. That was the first important feature at the general level which has happened. That is very important. Her generality started improving. She was quite happy with that. And she said one comment she has made, in last 1 week, I never wept. Very important feature. Then I asked, what about leukorrhea? She said it is nearly about 50%. I am feeling better. Its quantity has reduced a lot. And second important thing which she has mentioned, that I got periods when I started medicine. After 3 days, I got regular periods, and this time it is only on 33 days after I got the periods. It was wonderful. Remedy has acted at a center. So I have continued with the same thing, that I have just put it on little bit, 203 doses and followed with placebo. And within span of next 15 days, wonderful recovery happened. Her leukorrhea has stopped and everything. Then she started doing all activities. Her activity increased. She started reducing her weight. And she followed the diet. She started doing exercises, all those things. And she was looking quite happy, as well as a good look on her face because of loss of flesh. So that was a wonderful case of the graphitis. Graphitis has a very specific action, specifically at climacteric age. It has been mentioned by Allen in his book that what a pulsatilla is at the puberty, the graphitis is at the climacteric, and this is very clear. Graphitis is a good remedy to be think of at the climacteric age where the symptoms matches. So this sentence one must understand. So pulsatilla, the common elements of puberty, the delayed menses at the time of puberty, at the time of menarche with a weepingness. But that emotional weepiness is different in pulsatilla, and what emotional disturbance which you get in graphitis is rather different. So this is one case. And second case was a common case, that is a typical 25 years woman, again a obese lady. She came to me having a weeping eczema on hands and feet and also on the ear pinnas. It was discharging typical watery, transparent, sticky fluid, but she mentioned very, very specifically. She mentioned one comment, doctor, it is like a honey like. That was the sentence which was very characteristic. Graphitis is having that type of discharge. That is improving, that the discharges of graphitis, whatever the discharges, they had honey-like consistency, which was there. Then there were, when I observed I asked her to show me the palms. It was there on palms and feet. Then I have seen and I observed that nails are quite brittle, they are deformed, they are thick. So I asked, what about nails? She said, the treatment is going on, doctor. I have seen, it has been seen by dermatologist, and she said, you have the nail infection, the fungus of the nail, and that's why they are crumbling, or that's why they are deformed. So that was another thing which is very, very characteristic of the graphitis, the nails deformed. Then second thing, the tips of the fingers, there were cracks. That is another feature in petroleum and graphites, both remedies where carbon is element. The tips of the fingers, the cracks happens to be there. That was one important thing. And again, this lady also, it is associated with chronic constipation. The same quality of constipation. The stools are very hard. They are difficult to expel. She had, since menarche, she had always delayed menses, and it used to happen only for 2 or 3 days with little bit discharge. So these are the things which are very common regarding it. So I have considered this is again a graphitis, but in where here the dish, it was very superficial compared. I have started graphitis 6. Graphitis 6, 3 times a day for 5 days. I asked her to come. And when she returned after 10 days, dryness of the eruptions was there, discharge was stopped, eczema was there, itching was there, but discharge was nearly about stopped. Second important thing, her fingertips cracks, those were settled. The stools were better because she started getting the regular stools, but she has to strain. So for follow-up, I have utilized a 30, few more doses followed with placebo. And with 30, she made a very fast recovery regarding all the complaints. This is the remedy which has a very typical excitability associated with skin manifestation, and it is very specific for the skins where the eczema is VP eczema. It is called as VP or weeping eczema, the characteristic of graphitis. Petroleum, you have a dry eruptions more. Here it is, they are more of a VP. So this is a second case which I have worked out with the graphitis, and patient has settled. Let us go with Allen's keynotes. We'll learn few aspects of graphitis in today's session. It is a black lead, amorphous carbon, suited to women inclined to obesity. See, in the first sentence, he mentioned the constitution, how the ladies are there. Generally, it is a very common remedy for women than the males. It is very less indicated in males than women. And what type of women? The obesity is very characteristic. Who suffer from habitual constipation. Underline this sentence. Habitual constipation is very characteristic of this remedy. Yes, Dr. Chandrakant Bhavkar, he has mentioned mesothelium is also having wet eczema. But in mesothelium, there is one important feature that the thick crusts are there under which the pus is collected in mesothelium. The discharge is pus-like more in case of mesothelium. It is a syphilitic remedy. The graphitis is more soric in nature. So there is a difference between mesothelium eczema and the graphitis eczema. So suited to women inclined to obesity who suffer from habitual constipation with a history of delayed menstruation. Underline this sentence. Carbon produces that delayed menstruation always. These are first paragraph itself defines how the lady will be. So what future she brought is not important. What is the characteristics which are related with the generalities? Those are very essential for us to understand. So inclined to obesity, suffers from habitual constipation, history of delayed menstruation. These sentences give you a detailed information. Second important thing which he mentions, what pulsatilla is at puberty, graphitis is at the climacteric. See, very important sentence. No one understands properly. Pulsatilla is the remedy where the menses has just started. The menarche has started. Puberty is there. And this hormonal change which happens to be there affects her at an emotional level. She becomes more weepy, more emotional. Pulsatilla also feels better by weeping, but not that characteristic which is there with the graphitis. Pulsatilla had again irregularities of menses, many times delayed menses or suppressed menses that is there with the pulsatilla. This is the remedy. Graphite is specifically hormonal change which happens at the latter age, at the age of menopause. Both remedies have their impact upon the hormonal changes, but one is at the menarche, another is at the climacteric, at the menopause. Excessive cautiousness. That is the characteristic of the carbon. They are very cautious to do anything. First, they will find it out whether it will affect them, what problem it will arise, whether it will cause anything in future. So they are very, 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 very typically cautious regarding doing things, and then they go ahead. That they don't have directly a confidence. They are not decision making. Direct decision, no, not there. It is not like syphilitic remedy. It is story. That's why they are more cautious. Second important feature is that they are timid. Timid means bhitra. They are not able to, they are not at all rash. They are timid. While doing anything, they are always timid. Never goes ahead immediately. Hesitates to take the decision. Indecisive. Same to the pulsatica. That's why it's very difficult to compare, but age factor is very important. Hesitation. How to ask, whether I will ask, what they will say, whether I ask or not ask. So they are quite indecisive whether I should purchase this or not purchase this. This is always there. The hesitation regarding to taking the decision anytime. That is very typical with this remedy. Unable to decide about anything. They are not able to decide about anything. Never able to come to the conclusion. So indecisiveness, irresolution is the characteristic of Graphites. Same is true with the pulsatilla. Pulsatilla is more dependent. She's more dependent what to do and what not to do, and that's why she cannot take a decision. Very difficult for pulsatilla to decide. The same is true with the Graphites. Graphites, they are very hesitate to take the decision. Exactly opposites are the Kalis. There is anxiousness. But here, Graphites, the anxiety is related with taking the decision. Kalis are more responsible. They are quite responsible. That's why they used to go for or to take the decision and they go with that, and they are very, very, very particular regarding the timing, regarding the duty bound are there. Here the hesitation is very characteristic with the Graphite. Fidgety while sitting at work, like Jinkum, like Rus, like Medorinum. These are the remedy where the fidgety is very characteristic. When they sits in front of you, they are moving their lower extremity, tuck, 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 tuck. This is going on. Fidgety, very characteristic of all those remedy. Medorinum, you should not forget. The Rustox is one more remedy. He has mentioned regarding Jinkum. Yes, Jinkum, it is very characteristic. But Jinkum, it is associated with some neurological troubles. You get the tics, you get the twitching of the muscles, you get chorea-like movements in Jinkum. That is typical with the Jinkum. Rustox never feels better by sitting stiff. They are feel better by moving, and that's why that is automatically happens over there in case of Rustox, because of that they feel better. Sad. See, this is very important. They become sad, despondent. So sadness always comes on the triple thing. Something happens, they become sad. They become despondent. Then they weep, and then after weeping, they feel better. Again comes into them. Music makes her weep. They are so emotional that they become sleepy just listening the music. Very sensitive to music. Very sensitive. They listens and they starts weeping. Thinks of nothing but death. That is another point which comes. The question of death comes over there in their mind. They never go attempt suicide, not at all. That daring is not there. But basically, there is one thing: the thoughts of death. They always comes because whenever they become despondent, whenever they become sad. So music is intolerable. That is different, and music makes her weep is different. Music is intolerable in Netram Ka Sabayana. There is music is intolerable. They cannot tolerate any type of music. Here it is not intolerable. In fact, they likes music. But whenever the music is sad, it makes her weep. So that is the very characteristic, because that indicates the sensitivity. The sensitivity at the level of music. They are so emotional. They listens music, they listens the sentences in that music, and then they get emotional. That is the characteristic of this graphite. Eczema of the lids, eyelid eczema, the eruptions on the eyelids. There might be sometimes even a scaling over there. Eruptions moist and fissured, lids red and margins are covered with scales and crust. Borax, you can get sometimes such type of fissure, but it is very marked with the graphite. They always have very typically a scaling over there. So very important feature of eczema of the lids, that a scaling you can see over there, then the crush you will going to get over there, and generally there is a whenever it happens, there is a redness of the margins that you can very easily catch it. Yes, Dr. Shubhangi, she has asked, is fidgety and tremor different? Yes, sure, they are different. Tremors are different. Tremors, tharkap. These are the tremors. Fidgety is like this. They goes on moving the legs. Fidgety is restless legs. Restlessness of the legs is fidgety. You observe many people, they have restless legs. When they sit alone, they move there. But it is not tremor. It is movement. Tremor, it is a just a moving. This is uncontrolled. Both are uncontrolled, in fact, but this is tremor is different. Sexual debility from sexual abuse. Very important feature again, sexuality. Carbons generally they are sorry. The sexual desire is very marked. They are quite sexual, but debility comes because of overactivity of the sexual. So this is again one feature which is very essential, one must know, and it is present in both sexes. Robin Murphy has mentioned very specifically, it is present in both sexes, not only with the males or not only with the females. Menses, too scanty, very important, too scanty. Oligomenorrhea, very characteristic. Menses are pale, they are not full-blooded, they are pale. They are late with violent colic. Dysmenorrhea is associated. They are late 2 months, 3 months, many times 40 days, 50 days. This happens to be there. They are quite irregular. Irregularity is quite marked. They are quite irregular. Sometimes they happens every month, sometimes 40 days, sometimes 2 months. It is not specific with this. Menses delayed from getting fit weight. They are always delayed because of getting fit weight. Pulsatilla is again mentioned. See the comparison of pulsatilla. Pulsatilla is very close to the graphites. Morning sickness during menstruation. What it means? It means that patient is having typical features like morning sickness, the nausea and vomiting and little bit vertigo and some indigestion or fearfulness, and that typical features of morning sickness which happens to be there in the pregnant ladies. These ladies got the similar type of features during menstruation. So symptoms which are closely related with the morning sickness of pregnancy, they are present in those ladies during menstruation. Because of that, they becomes very weak and prostrated. The weakness because of the morning sickness, because of nausea and vomiting at the time of menstruation, because of pain, the dysmenorrhea, they become so weak and prostrated. Alumina is one remedy having similar type of strong constipation, but alumina, there is not at all urging. It is obstinate constipation which you can get. Carboanimal is part of it as carbon. That's why it has very similar feature over there, carboanimal. And last remedy, cocculus is mentioned. The cocculus has a typical nausea at the smell and sight of food, as well as traveling sickness, which is there with the cocculus. So this is one more remedy for morning sickness, having the similar features at the menstruation. We'll read last sentence, the leucorrhea. Leucorrhea is acrid, excoriating. That is, it is as if producing a burns over there and the parts. Occurs in gushes day and night. It is written in bold. It has a significance. Gushing day and night, leucorrhea, very profuse. Leucorrhea before and after menses. Before menses, the leucorrhea is there. Even after menses is covered, the leucorrhea is persistent. This is characteristic of this remedy. Before menses, it is only sepia. After the menses, it is creosote. But when before and after, you must think about the graphites. So this is some part of the graphites which we have learned, the mainly the female complaints, but there are many more about the female complaints also there in this remedy. Tomorrow we'll continue with that and we'll learn the few more features about the same remedy and we'll understand it in depth. Again, I will share two cases in tomorrow's session, so it will be more easy for us to understand that remedy and make things becomes clear in our mind. So thank you being there for attending session. Thank you many practitioners, they are attending sessions. Thanks to them. We'll meet again in tomorrow's session with the same remedy at the same time. Yes, this is more common female remedy. No, it doesn't mean that it is the only remedy. It is most commonly the female remedy, feminine remedy. Any other query? So thank you being there. We'll meet again in tomorrow's session at the same time. Good night.
Thank you, sir. Good night.